Respiratory Therapy, Lesson 5, In-Use Inspection of Ventilator. This course covers the basics of respiratory therapy. The goal for this lesson is to learn about the items to inspect during use of a ventilator. This is the content of this lesson. First, let's review the previous lesson. Inspection of a ventilator can be broadly divided into two types: periodic inspection and daily inspection. In this lesson, we will go over the in-use inspection as part of daily inspections. In-use inspections are performed at the bedside while a ventilator is being used on a patient. In-use inspection items include checking proper operation of the ventilator and heated humidifier according to the pre-configured settings, and that there are no malfunctions in the breathing circuit. We will describe the inspection of a breathing circuit, heated humidifier and ventilation operation. When inspecting the breathing circuit, check each connection for looseness, damage or leakage. For the heated humidifier, confirm that it is operating according to the preset temperature and that there is an adequate amount of distilled water. In the case of using an artificial nose, replace it according to the designated number of days. Also, visually check for the amount of condensate water in the circuit and remove the water if necessary. For ventilation operation, the first step is to check the waveform and values of the ventilator to see if the ventilation is working properly. The most important thing at this point is to look directly at the patient's thoracic movements. Checking the patient's vital signs is just as important. Next, check if the system of the ventilator is working according to the configured settings, and confirm the settings are appropriate for the patient's condition. As the patient's condition changes, it is necessary to evaluate the operation from various angles by assessing X-ray, blood gases, etc. in addition to the settings of the ventilator. Lastly, ensure that the range of alarms is within the optimal range for the current patient. Since in-use inspection is performed while the patient is on the ventilator, assessing the patient's condition is crucial as well as confirming the device settings. This is the end of Lesson 5, In-Use Inspection of the Ventilator. Make sure you've mastered the basic concepts before you move on to the next level.